Welcome everyone, pleasure to be here. Especially grateful to Jack Caravanos, who has been our Director of Research for many years and is here now at NYU heading up their global health practice. And really grateful for him to organizing and bringing us all here together. We're here to talk about lead and its impact, especially globally. Let me start off by giving a little bit of a background about the work that Pure Earth has been doing over the last time in this area. And so just as a background, Pure Earth is a non-profit that was begun in 2000 to work on pollution problems in low and middle income countries. And we focused since that time in as many countries as we possibly can in doing projects that clean up acutely contaminated places. These are places where children are dying from lead exposure, from hexavalent chromium in drinking water, from pesticides, living next to pesticides dumps, or places where people are impacted by mercury from gold mining. And our core work is to implement projects that save lives, that go in and fix that problem, clean it up, and enable those communities to live in safe communities. And also to bring that expertise, which we bring often from overseas, into those communities and governments so they can move forward with doing that work again and again and replicating that work. So we end up taking small amounts of money, saving a lot of lives, and then replicating and enabling very large scale-up from that work from public investments. And this does not work, so if you could go to the next one, thank you. One of the things that we've done to try and bring more attention to this, because this part of the world, this problem in the world, doesn't have a lot of attention at the moment with all of the focus we have on climate change and infectious disease in public health. What we're trying to do to solve that problem is bring attention to how big the pollution problem is globally around the world. There's a report that comes out in The Lancet sometime later this year. It's called the Global Commission on Pollution and Health that I'm the co-chairman for. And that will outline the totality of the burden of disease, how much death and disability pollution causes around the world. And the numbers are staggering. 9 million deaths, 6 million of them from air pollution, about 1.7 million from water pollution and sanitation. Many more than 500,000, we're only measuring lead and one aspect of lead, in soil pollution and chemicals pollution, and then almost 1 million people that die because of occupational exposures to pollution. These numbers add up and are really extraordinary. And I just want to show them as a comparison against other major public health problems that we worry about in the world. So here, for example, this is Ebola. It killed about 10,000 people, and all of them tragic. But 10,000. This is war and murder. So this is every gun death anywhere on the planet, including those that occur from armies fighting each other. It's around 300,000 deaths. Road accidents, about 1.2 million. Malnutrition, the most enormous problem in poverty, 1.5 million deaths. Drug and alcohol use, all of that problem in its totality globally is almost 3 million deaths. HIV, malaria, and tuberculosis, the three big infectious disease problems globally. They're around 3 million deaths total. Sodium, high blood pressure, kills a lot of people, about 4 million deaths. And smoking is always the one that people think of as being the biggest cause of death as a risk factor, and that's around 7 million. But pollution's bigger than all of those. So this is new news that we need to get out into the world so people can change their priorities and begin to allocate some of their energy and effort into the pollution agenda. I want to also point out where those deaths occur, and it's all in low and middle income countries. The dark red countries are places where 1 in 4 people die because of pollution. So in some of these places, on average globally, it's 16% of all deaths are attributable to toxins. In some countries, it's 1 in 4, 25, 26% of deaths are attributable to toxins. And you can see it's really the developing world where industrialization has gone rampant in the last 20 years. Urbanization also has brought people crowded into cities, and that net benefit has really increased pollution dramatically. So one part of that analysis is dramatically undercounted as well, and that's the soil and chemicals agenda. So in the analysis, the risk factors that we can use in the Lancet product, which come from IHME, they only include cardiovascular impact of lead that's attributable to the time when we had lead in gasoline. So as you know, or you may not know, lead not only causes intellectual impairment for young children, it also has a significant impact later in life where it causes cardiovascular disease and deaths as a result of that. What we want to do as part of the research agenda from this report is move forward and think on what is the totality of this chemical and soil pollution issues, and that needs a lot more research. And I've gathered those senior researchers from the Global Commission together, and bounce to the next one if you would, Angela, to think on how that might look. And currently we're looking at lead and occupational deaths around 1 million. We think that there's a lot more death out there in the lead agenda when we look at other exposures to lead that you'll hear about today, things like pottery in Mexico and the like. And there could be an easily additional 1+ million deaths. And then when we look at other chemicals and their exposures, mercury, cadmium, chromium, and of course pesticides, and all of the other chemicals that don't have a global burden risk factor, there's easily another 1 million deaths. And if we really added all of that up, we could see comfortably that the total burden of disease from chemicals globally is anywhere from 3 to 6 million deaths a year. So this is experts' best guess without having done the science yet. Comparison, malaria is 700,000 deaths a year. So this is an area that needs attention. And those of you who are researchers or looking to move into research, this is a burgeoning area where we've got a chance to make a lot of difference. So I also just wanted to show this. This is the disease by age. This is disability adjusted life years by age from all of pollution. It affects kids, and then it affects people in their 50s and 60s from cardiovascular disease. It's again like smoking, has an impact early on life, and then again later on in life as well. There's also research here that shows how some of the pollution agenda, the sanitation agenda, this green line, we've been getting better at it. We've been putting in treatment plants, we've been bringing clean water to people, and that death burden has gone down. But this is chemicals and air, the other side of the equation where there's no investment, and that death burden has gone up. Next one, please. And of course, just to demonstrate the disparity between that, could you click these on, please? Here are, again, repeating from that earlier chart, total pollution at 9 million. Here's HIV, malaria, and tuberculosis, and that death burden at 3 million. Here's the funding on modern pollution, on air and chemicals. It's around, at best, $50 to $100 million a year. Those three infectious diseases in 2016 had $28 billion spent on them. So the disparity really is extraordinary. So what I'd like to do now is to turn the floor over to Dr. Karavanos. Jack is an old friend and a wonderful man, and we're really grateful to have had him help us so much over all these years. And the floor is yours.
In New York, it's a global presentation, so I decided to use this format. Most of you know who I am. Thank you. Some of my students are here. That's great. I know many familiar faces. Thanks for coming, and I think you'll enjoy the content of these three presentations. I do want to say I'm also fortunate to be working with Rich for many years, Director of Research at Pure Earth, and helping sort of publish a lot of the work that this wonderful organization does. So let's go back to the map. I am going to jump around. Primarily, I'm going to jump through to Africa. And in Africa, the way I'm going to present the health effects aspect, instead of giving you a list of all the health effects of lead on and on that you've seen a million times over, I'm going to do it a little differently. I'm going to focus to a couple of countries and tell you what's going on. Specifically, here we have Zambia. And I just got back from Kabwe. It's my fifth trip there. And what you see here is this gray area, which is a historic lead mining. This has been going on for, Rich wrote about it in his book, and he's been there. He's been singing the bad news. No, you don't sing bad news, but talking about the disastrous conditions in Kabwe since 2003, when he was involved with it. And here we are 10 years later, and it's still horrible. It really is, in my judgment, probably the most polluted place on the planet, and having the most serious health impacts. So what you see here is a lead mine, a city of 200,000, people living right up near the lead mine, and the entire site is contaminated. We've taken so many measurements, but this black mountain you see is actually lead slag. And just as we see scavengers throughout New York collecting bottles, well, they're the scavengers of the planet, and we see them collecting all sorts of things. And what they're doing is essentially going here and collecting this material and bringing it to a local refinery for recycling. So this is the exposure. Not to mention people are using the ore for ground cover. Despite repeated efforts of the danger of doing that, we still see it done in these homes, and we have some horrible numbers I'll share with you in a second. Yes, you are looking at a man walking downhill into this tunnel. I did not have the courage to do this, but Larry Price went into that hole. But he's a consultant, so there's no worker comp issue there. So but I stayed outside the hole for a couple of reasons, taking soil samples, and everybody's wondering what we're doing. And of course, the area is populated with the next generation of scavengers, right? So this goes on and on, cycle after cycle, we see this going on. And of course, it's a dry climate, very dusty, material flying around everywhere. So the entire city is contaminated. I'll give you some numbers in a second. We see, of course, the inevitable football pitch all over town, bare feet, playing. This is what kids do. I actually have a nice picture of the cleverness of using plastic bags. If you take like 500 of these and wrap them together, you have a nice football. So it's pretty clever, these kids. So here's a building. I won't tell you what it is just yet. I know the image is not great. It's the best I could do. And if you look more closely, you see the lead soil levels. Now, the EPA standard is 400. And I see my colleagues in the back, Lillian, in shock with some of these numbers. 11,000 parts per million, 1,200, 5,000. By the way, this is 11,000 is 1.1% of the soil contains lead. It's almost to the point where you could collect it and sell it to a recycler and make money. This is the topsoil. And some of these numbers, 10,000, 10,000, 13,000 ppm. Just to give you a sense, there's a site in Brooklyn, a lead smelter site, in, I'm blanking out at the, Red Hook, thank you very much. EPA's dealing with it. What are the levels there? 600, 700, 1,000. I almost chuckle. I said, you have no idea what this is. So what is this building? This building is the health district office. This is the old maternity. This is the new maternity wing. When we go here, and we go here a lot, there's usually dozens and dozens of people with families waiting for treatment, drugs, malaria, HIV testing, on and on and on. And this is just an example of one site. This is always a shocker. Yes, you are looking at what children do best, and what they love to do is play with mud and make things. And of course, this is soil that has 2,300 parts per million lead. So all you need, where is he? All you need, Michael, is Michael Weitzman knows about lead. Just touching your mouth, your fingers to your mouth, you're already at levels of 10, 20. All right, so that's Zambia. But now we don't have proof of health effects. We need that. We don't have bodies. But we do have bodies in this particular country. We are now in Senegal, Chero Sumer, here we are. And what happened here is batteries. Now, I'm not going to tell you more about batteries because we have someone online who will discuss that. But here was a process of breaking batteries and recycling the lead. And in this particular community, the levels were similar. I know you can't read this, but you could probably figure out that red is bad, green is okay, sort of, yellow is in the middle. The levels, again, were sky high, lower than Kabwe, lower than Kabwe. And what's the point here? If you look at these numbers, these are blood lead in children under 4, this is really maternal exposure. A 4-month-old doesn't pick up lead. 99, 131, 151, 5 micrograms, but you may have missed the header on this. The header is deceased. And this is 18 children confirmed fatalities in 2010, and possibly ongoing, right? We really sort of just hit the surface on this. It's hard to say it's just stopped at 18, right? Because this has been going on for years. Luckily, this site's been addressed. However, it's a constant battle to get people to stop sort of recycling these batteries in the lead. And this is the exposure. This is a little Senegalese girl playing, again, barefoot in soil, filling up a bag, emptying it. This is very, very common. Okay, so now we're back in Africa, but nothing compares to what happened in Zamfara. Several of you know this story. If you don't, it's a must in public health. This is an extremely difficult area, and you can read some of the bullet points here. Aside from, it's also a dangerous area. This is where the abduction of the girls occurred by Boko Haram. This is an amazing story of MSF going in saying, we want to vaccinate your children. Bring us your children, right? This is what MSF does great. Well, there were no children in town. They're gone. Because what do you mean they're gone? He goes, they died. And sure enough, more and more people got involved. We got involved with a cleanup, Pure Earth. I've not been to Zamfara. It's a very difficult area because of Sharia law. Men can't really be anywhere near women. So imagine doing a remediation in conditions like this. And we're not talking a few villages. We're talking a whole area that primarily was inadvertent exposure from gold mining, which they use mercury, which is another dirty talk one day maybe. And the soil had had naturally occurring lead sulfide. So in the process of getting out the gold from the soil, they were exposed to lead. So they weren't even going after the lead. So horrible numbers. We could zip through some of this. Some people are saying 400, some people are saying 800, some people are saying 200. Do we really know, right? It's even hard in the US to put a precise number on fatalities. But in this case, it's even more difficult. But 400 children, right? I mean, I dare any of my environmental physicians, do we know of a child in the US who died of lead poisoning? And the answer is yes, because every now and then they'll swallow some lead material and they'll get a serious poisoning. But it is really quite rare. And here we're talking fatalities, not cognitive damage. This is amazing. So this is just 3 countries. But everybody uses batteries. Ghana, Ivory Coast, Sudan, all these, Ethiopia. So these are just some of the hot spots. And of course, you know the damage. Rich did a fine job of bringing to the attention of cardiovascular, right? We generally don't associate this with lead poisoning, but more and more, it seems like the epidemiology is showing that it is a significant contributor. So when you add that to the array, you get very high DALYs, disability adjusted life years. And we have, of course, other conditions. All of the speakers will mention health impacts to some extent. So that was my little present introduction on global lead poisoning. I want to just tell you that we have Chinanka in Indonesia. We have, Drew will talk about Bihar in India. Ruben will, I'll introduce him shortly, on Mexico. We have Peru. I've been to many countries. We really don't know much about China. They don't really talk to us too much, and they don't want us there too much. But I suspect when you look at how many mopeds and vehicles and batteries are being used, you're getting significant exposures there also. So thank you for your time, and I think I'm going to introduce our next speaker. Right? I don't think I have any more slides. Right? Good. We're very fortunate to have Ruben Kracham here today, and particularly fortunate because he's a board member at Pure Earth. Now, board members participate, they're great people, but rarely do they want to get involved in our projects. Well, Ruben is one of those people. So we're really proud to have him here to talk to us. He's an attorney with Covington and Burling here in New York. He will take us west to Mexico and talk to us about that pottery you see in the back of the room, some of which was purchased here in New York. Okay, Ruben, it's all yours.
Good afternoon, and thank you for having me here. My name is Ruben Kracham, and I am a board member of Pure Earth. I'm actually from Mexico, and first became involved with Pure Earth on account of this very project. I am a lawyer, not a scientist, and my role has been primarily to work with the Mexican authorities on behalf of Pure Earth to facilitate communication on this issue and to encourage the government to move forward in resolving this problem. And I'll now try to describe it to you as best I can. Pure Earth has been involved in looking at this problem in Mexico for many years, but perhaps the first really significant step was the publication in 2014 of a survey article that Jack and Richard and others associated with Pure Earth were the lead authors of, that did a survey of measurements that had been reported in studies that had been made of population in Mexico where lead was actually measured. Blood lead levels were actually measured. A process was followed to determine which of these studies were reliably comparable and could be included in the survey. And the conclusion of this survey was really quite alarming, drawing on information that was already in the public domain. What this shows you is that in rural areas and in urban areas, blood lead levels have declined over time in Mexico from alarmingly high levels in the early 1980s to significantly lower levels today, which substantially reflects the elimination or the phase-out of lead in gasoline in Mexico, which is a process that was initiated in the late 80s in the administration of then-President Salinas and has now effectively been done. Now that has had very significant public health benefits, but the point of the survey article was that even measurements that were taken after the year 2000 continued to show alarmingly high levels of lead in children particularly, at levels that would probably account for or be reason for significant cognitive impacts among many other health effects. In fact, I think the most alarming, the most interesting conclusion of the study is that approximately 15% or 15% or more of children that were somehow captured in these surveys are likely to have had lead exposure sufficient such that they would have a loss of IQ of at least 5 points. The means, the medians that were found in infant population, in child and adolescent population, and in adult population were all above the WHO reference levels. We then tried to figure out what could possibly be the source of lead poisoning that was affecting the population. And the working hypothesis was that a product to which Mexicans are very, very widely exposed and that has a deep traditional role in Mexican life could possibly be the culprit, and that is traditional ceramic that is glazed with a lead-based glaze. The lead-based glaze gives it that shine and seals the clay, and is in fact something that's been in traditional use in Mexico for literally centuries. Now, what we undertook to do, now let me explain something very quickly about this. There are two ways to produce this kind of traditional ceramic. You can produce it in a high temperature kiln, which typically uses natural gas, and it actually seals or fixes the lead in such a way that it does not leach into the food that is either cooked or served. So a high temperature kiln will avoid the problem. However, the overwhelming majority of traditional artisans are using wood-fired, low-temperature kilns that don't have that effect on the lead. As a consequence, the pottery that is produced will leach lead into the food that is prepared at a high temperature or is acidic. And of course, it's primarily the poorer people who consume the traditional lead-based glazed ceramic that have the highest exposure. So one thing that Pure Earth did with the assistance of the Instituto Nacional de Salud Pública, which is the research arm of the Federal Ministry of Health, the Instituto Mexicano del Seguro Social, which is the public health system run by the federal government and the government of the state of Morelos, was to conduct a survey, or a study rather, of blood lead levels in newborns in the state of Morelos, which happens to be a state where there is a significant critical mass, if you will, of producers, and of course a very important state in the country. So what it found was that in urban areas, roughly 14.7% of the newborns already had elevated blood lead levels, and as much as 22% of folks in rural areas, typically the poorest, most marginalized areas, had elevated blood lead levels. In other words, blood lead levels that were already harmful to them as of the time that they were born. Now, one other thing that was done was to interview the mothers who had given birth to these newborns, and try to correlate their prior use of leaded ceramic and see whether it coincided or corresponded with the appearance of these elevated blood lead levels, and indeed it did. Now, this adds to the body of evidence that exists that what you have in Mexico is a traditional product, widely available, extremely widely used, that can very readily cause irreversible harm. Probably the removal of this product from use would be the single most cost-efficient and substantial step you could take to enhance the cognitive capability of a huge percentage of the population, their ability to be educated, their ability to live productive lives, their ability to avoid all sorts of very, very severe health problems that are with them for the entire rest of their lives. Now, why is this such a difficult problem to solve? Is there a substitute for the lead-based glaze? Yes. The answer is there is a substitute. There hasn't always been, but there is now. Does it provide exactly the same aesthetic? There's a division of opinion on that. There are some folks who continue to say, no, it doesn't quite give you the same shine, but it certainly provides all of the requisite basic services of the product at a vastly, vastly great benefit to your health. What is then the problem? Well, a very big part of the problem is that this is a very, very disaggregated industry. There are literally tens of thousands of individual workshops that produce this pottery in these low-temperature kilns. And they're not organized in any way. There's no vertical structure, that you could use to, on a top-down basis, say from now on, we're all going to source only lead-free glaze, esmalte. We're going to stop using the greta, which is the lead-based glaze that we've been using traditionally. There is simply no way to do that except one by one in a very incremental fashion, unless you can actually affect very significantly the overall environment in which these folks are operating. Now, Pure Earth has been undertaking a series of initiatives to do just that in the state of Morelos, including the creation of a seal of good practice, if you will, that we call Barro Aprobado, that restaurants and stores that provide these products or use these products can show to say, we're serving our food here in lead-free ceramic, or we're selling lead-free ceramic. And that, of course, is creating some measure of demand for the artisans. Similarly, we are going and literally educating groups of pregnant women, for example, on the risk of using lead-based ceramics or ceramics containing lead to cook and serve for their families, etc. However, the key challenge here is to scale this up, is to be able to reach more and more people and to be able to actually make a systemic change. At some point, there's going to be a tipping point, but we're extraordinarily far from it. As of now, we know of only a few hundred, at most, artisan workshops that have made the transition. Now, to this end, we have wanted to work very closely with the Mexican government at the federal level, and in some measure, thanks to efforts that we made as an organization, the message has been communicated to the Federal Ministry of Health. Richard and I and a number of other colleagues met personally with the Secretary of Health of the country, who is the former dean of the National University and a physician, who immediately understood the importance of acting on this, despite the very real constraints that the Mexican government has, both budgetary and political, for a variety of reasons that I won't go into. And it was the secretary who directly instructed the head of Mexico's essentially Food and Drug Administration, the COFEPRIS, to put together a program on a national scale to address this problem. And that program is in the process of implementation now. It involves actually enforcing against the producers of the lead-based glaze, enforcing against them the norm that requires traceability of the use of that particular glaze. So in other words, you can use it for all sorts of things, but you cannot use it, and you cannot sell it to someone who will sell it to someone who will use it to produce ceramics that are in turn used for the preparation or the serving of food. That's an enormous challenge for the government to accomplish, but they are working on it. I think Pure Earth can take some of the credit for the government having decided to do that in a concentrated fashion. They are doing a great deal of work and trying to fund the individual states to accomplish this, but there's still an enormous road ahead. And we've only just gotten it started. But from the standpoint of having identified a public health problem in Mexico that is crying out to be addressed, I think Pure Earth to date has done a very good job. Now I will introduce, Drew Macarthur, who runs our project in India and who's going to participate in some fashion that Angela's going to explain.
But my name's Drew Macarthur, and I serve as Pure Earth's Regional Director for South Asia and East Asia. And I'm going to talk about a specific source of lead pollution that Jack alluded to, and that is batteries. And specifically, the type of battery that is called a lead-acid battery, or that we would refer to commonly as a car battery. But in other parts of the world, particularly lower-income countries, these batteries are used for a much broader array of activities. For example, in countries where the power cuts out frequently, most homes will have these batteries in their home to provide electricity when the power is out. So there's a tremendous volume of these batteries all over the world, and we find lead pollution resulting from these batteries across the world, and that pollution specifically comes from the recycling of these batteries. In the US, these batteries are recycled in a very good closed-loop system that doesn't lose any lead. But in lower-income countries, frequently these batteries are recycled informally, using very crude tools, and often done in public spaces, in backyards, in mechanic shops. And what that does is it results in the release of a lot of lead dust, which is particularly harmful for children. So let's take a very quick look at what this issue looks like. This gentleman is conducting this informal recycling process. It can be done with as simple tools as a hatchet to crack open the plastic case that that the lead is held in, and then a very small furnace. And what they do is the battery has about 65% lead inside of it. It's lead plates in a bath of acid. And you simply remove those plates, separate them from their casing, and then melt them back down into lead bars, which you can sell back to a battery manufacturer, because of course lead is a valuable commodity. So people in marginalized communities that need to find a source of income can conduct this activity with very little training, with very little capital investment. But unfortunately, it's incredibly dangerous. Here are the lead bars that have been melted down, and these will go straight back to a battery manufacturer to be made into new batteries. So I want to talk about this in the context of our work in India, where we're organizing a project in the poorest state in India, which is called Bihar. Bihar receives a tremendous amount of batteries, not only from their internal use, but they also get batteries from Nepal and Bangladesh. And more than 50% of those batteries are recycled in this informal manner. So I'll show you a couple of the sites that we're going to work on in Bihar and describe what our risk reduction activities are in these sites. One of these neighborhoods where this activity takes place is called Karmali-Chuk. It's where a single operator was making batteries informally, and his workshop is indicated with the arrow on the right. And it was about 10 yards from an elementary school. And when we conducted an environmental assessment of the soil around this neighborhood, we found that lead levels in soil were up to 20 times the US EPA standard that Jack mentioned, including soil samples taken at the front door of the elementary school. So one of the approaches that we'll use here is to simply cap contaminated soils with clean soils. And once that lead is effectively buried, it becomes much safer. The neighborhood is safer. So we will conduct this type of remediation. We'll also conduct community education and health screening so that we can see the before and after impacts of our project. Another area around the capital city of Bihar, the capital is called Patna, is called Kankerbagh. And in this area, about 12 little storefronts do what I call battery tinkering. They refurbish batteries, they recycle batteries, they assemble batteries. And even though it's a very small scale activity, they've broadly contaminated the neighborhood. And again, you can see these black dots indicate levels of lead in soil that are 20 times above EPA standards. And in this location, we're going to use a different type of risk reduction. We're actually going to work with this community to move the dirty aspects of their process out of this residential neighborhood into an industrial estate where any lead dust that is released is not available to neighborhood children. Once they move, we'll go back and do the same kind of capping technology that we talked about at the first site. And again, education and health assessments are critical. So this is a video which I don't think we have time to show you, but about what I mean by battery tinkering. This guy is pouring lead into a mold and just making little parts. And he's conducting this activity on a public sidewalk. The third area that I want to show you is a small neighborhood where a manufacturer makes batteries from scratch, meaning he makes all of the components that go into a battery and then assembles them on site. Again, this activity has contaminated the neighborhood. And here we're going to use a third type of risk reduction method. We're going to work directly with him to improve his process, to move the manufacturing around to different parts of the workshop, to try to control dust, to improve worker safety. And then again, this will be complemented by community education and health screening. In all three of these neighborhoods, we're also going to go into private homes to remove lead dust from homes, because frequently this dust can migrate into the home where it becomes very available to children because they're playing on the ground and they have a lot of hand-to-mouth activity. So this is 3 examples of risk reduction technologies that we'll use at 3 different sites that have 3 different contexts within the capital of this state. I don't think we have time to show you. I have these videos about how the process is made, but effectively these guys are making lead screens. They have a cauldron of molten lead there. They're making lead screens that become lead plates. This guy takes those lead plates and applies a lead paste to them. That lead paste dries, it becomes a hard plate. Then those lead plates are soldered together and they're dropped inside the plastic box that we're familiar with. They add sulfuric acid to that box, they charge up the battery, they melt the top closed, and then that is a battery that's ready to go. As I said, health assessment is critical to this work so that we can show the community the value of the remediation work that we're doing, but also communicate to them the risks. So when we show them the results of blood lead tests before we start, we can say, these are the levels of lead in the children in your community. These are the health impacts that would likely accompany those levels of lead. And then when we're done, we can go back and conduct that same blood work again and show a reduction in blood lead levels and thus a reduction in risk. And then finally, I just want to talk about what makes a good project from our view. Why did we choose to work in Bihar, India? We look at a couple of factors. One, is there a significant risk to children? And we base that on the environmental assessments that we conduct. Do we have a capable partner? Because we never conduct this type of work alone. Do we have high levels of acceptance within the government and the community, which is critical to success? Is there high feasibility? We've done this type of project around the world, so we think that it's quite feasible in this community. We think the cost benefit in terms of health improvements versus the cost of the project are quite favorable. And finally, in many countries, this type of project has never been done before, so it often has great demonstration value and is highly replicable because it's a pretty cheap intervention. So it's something that a state government could pick up and do again on their own. And that is a very quick summary of how we address the battery issue. Thanks all.
Thank you, Drew. Thank you very much. Thank you, Jack. Thank you, Ruben, for showing half a dozen examples of high exposures to lead. There are hundreds of thousands of more places like this. As far as we know, there is no other activity going on around this issue other than that which we're undertaking, which strikes us as extraordinary. Here is something that has a burden of disease larger than HIV, larger than malaria, and our smallish NGO is the only group who's really trying to do anything about this in so many countries around the world.